enter the room.
Hi, I'm Dr. Rianne. I'm one of the FY2s in the GP clinic. Could you please confirm your full name and age?
Hi, doctor. My name is Margaret Thompson, and I'm 65.
Okay, what would you like me to call you?
Margaret is fine.
Okay, so tell me what brings you in today?
Well, doctor, my daughter actually helped me make this appointment. She seems to think that I could be suffering from dementia.
Okay, is there any particular reason as to what your daughter, can you tell me more about what your daughter's noticed that could prompt her to want to come in to the GP?
Actually, there was an incident where I was supposed to, go to a bank for an appointment at 10 a.m. and accidentally I completely forgot about that and I ended up at 1. And, such instances have been happening a lot lately.
Okay, I understand that must be quite overwhelming for you. Do you have any particular ideas that you could think that could be going on?
I'm not sure, doctor, but I have been noticing that, such similar instances have been occurring, where I place very important items and and I don't remember where I've kept them, and yeah, that's not usually that happens with me.
Okay, thank you for sharing that. Could you tell me when you first noticed this?
I can't really, put a timeline to it, but I would say around 6 months. But it's been getting worse in the last 2 to 3 months now.
Okay, it's been going on for quite a while. Is there anything that you're particularly worried about?
Yeah, even I feel that it could be something along the lines of dementia.
Okay, I'll just need to ask a couple questions so that we can get a better understanding and then give you the most appropriate support. Is that okay?
Sure, yeah.
Okay, have you been having any problems remembering new things lately?
Yes, I find it very difficult to keep up with my appointments, whenever I schedule them, I find it very difficult to, remember sometimes.
Okay, I understand. And have you been having issues remembering people's names?
Yeah, that's one other problem that I've been having. I've been, confusing a lot of my grandchildren's names.
Okay, I understand. And has anyone mentioned that there's been any changes in your personality or your behavior recently, other than your daughter?
Well, it's mostly this forgetfulness, but nothing more really.
Okay, I'm just going to ask some questions so that I can have a clearer picture of exactly what's going on. But please bear with me. So could you please tell me what year we're in?
2025.
And what day is it of the week?
Monday or Tuesday. I think it's Tuesday.
Okay, and do you know what time it is right now?
I'll have to check my watch for that.
Okay, all right. I'm going to give you 3 words, and I'd just like you to repeat after me. Okay, after I've completed these words. So apple, penny, and table.
All right, apple penny table.
Okay, thank you. And are you able to say the word world backwards?
Oh, world. You mean spell it?
Yeah, spell it backwards. Yeah.
Uh, I'm sorry, L, uh, O, W, R, D. Yeah.
Mm. Okay, thank you. Thank you for and are you able to repeat what the 3 words that I've just said to you earlier?
I remember there was an apple. Yeah, that's about it.
Okay, thank you for answering this question. Um, uh, and what's happening? Is it affecting your day-to-day activities?
Yes, doctor. It's mainly, I'm unable to keep up with my appointments and my schedule. Yeah.
Okay, I understand that must be very overwhelming for you, but we're here to
Mhm.
support you. And tell me, how has your mood been recently?
Yeah, it's been all right. I've been quite pleasant.
Okay, and have you been seeing things that others are tell you that it's not there?
Oh no.
Okay, and I'd just like to ask some questions about your just general health lately? Have you had any fevers recently, or just burning sensation when passing urine or anything like that?
No, doctor. No,
Okay.
sir. Mhm.
Have you been generally well in yourself?
Yeah, yeah.
Uh,
I'm pretty healthy.
Okay. And do you have any medical conditions?
Yes, I have diabetes.
Okay. And for how long have you had diabetes for?
It's been about 10, 15 years, I think.
Okay. And are you taking medication for that?
Yes, I'm taking metformin, it's called.
Okay. Are you taking that regularly?
Yes, yes. It's given to me 2 times a day.
Okay. And are you regular with your GP?
Yes, yes.
Okay. And have you had any other medical conditions in the past?
No, doctor.
Okay. Have you had any symptoms such as headaches recently, or you're not able to move your body, any parts of your body?
Yeah, no,
2
actually.
minutes remaining.
Okay. And you've never had any history of having strokes in the past?
No, doctor.
Okay. And has anyone in your family ever had similar symptoms like this?
Yes, actually, my mother suffered from Alzheimer's.
Okay. Thank you for sharing that. And as I know, do you have who do you live with at home?
Oh, I live with my husband.
Okay. And is he very supportive, and do you have
Oh,
any support?
absolutely. He's very supportive. Yeah.
Okay, thank you for sharing that. So based on what you've told me, I'd like to talk about ways in which we can help manage what's going on. There are things that we can do, and then there are things that you can do from your side. So I'll talk about ways in which we can help you with what's going on. And
Mhm.
thank you for sharing your concerns as well. So
Mhm.
you mentioned that you've been having issues with your memory lately,
Mhm.
and we've assessed your did a mini mental status of your and it's quite I would say it's showing some mild impairment. For that
Mhm.
reason, I could offer you the chance of being referred to a memory clinic. Is that something that you're thinking of?
Yeah, sure. What happens in this memory clinic?
So in the memory clinic, they'll do a full comprehensive checkup to see exactly what's going on, because there's many causes of having sudden memory issues. It could be caused through like having problems with your thyroid or infection or any issues. So they'll look into it further, and they'll do further assessments.
Okay. Hmm.
Okay. What we could do, we can do some blood testing. We can look at your blood levels, look at your function of your thyroid, and maybe look at your blood glucose
Move
levels.
on to the next station.
Yeah, there's not always time.
But good job, I would
Yeah,
say. Definitely, good job. I think you covered a lot of good data gathering aspects there. Good job on that. But
yeah,
see, in these kind of stations, you do run out of time when it comes to management. See, what
yeah,
you're trying to do is you're trying to have a conversation with me, involve me in the decision making. That's very good. But by doing that, you're actually focusing on just one aspect. Just the memory clinic and what are the blood tests that you are going to do. So
yeah,
how would you be able to sum it up and yet have a conversation, right? So this is one thing that even we also realize is one of the major problems when it comes to management. And once you hear the 2 minute timer go, because you did reach management by 2 minutes, right? I mean, I wouldn't say it's that great. You try to actually keep like 3 to 4 minutes for management because you have a lot to talk about management, and it consists of 4 marks, right? So the 1 or 2 questions that you're asking for data gathering, it's actually taking time, and it's taking your management time up, right? And that's something that you want to avoid, because for those probably zero point 0.5 marks, you're actually sacrificing 4 marks in management. So think about that, right?
yeah,
So as soon as you get your diagnosis, you just want to stop and go to management because you have 4 marks to get there, right?
And I noticed that you were still asking questions even after hearing the 2 minute bell. So 2 minute bell is your warning. It's only there to tell you to stop your data gathering. Otherwise, there's no other reason for the 2 minute bell. So you have to somehow abruptly stop your data gathering. Maybe take like 5 seconds max to finish what you're asking, and then move on to management, because any time less than 2 minutes you spend in data management will definitely hurt your management marks, because 2 minutes itself is not enough. So make sure that you take that warning very seriously. The 2-minute bell is there. You definitely you should not be doing any more data gathering at that point.
Yeah, definitely. Because one thing is that, even the data gathering that you're going to do, it's only going to count for the data gathering marks. And you've already managed to get like something around 3. So you won't get anything more than that. It's very rare. You might actually get 4 out of 4, but even if you might just get point something for it, and you're actually sacrificing 4 marks in management. So there is so much more that you can get, right? So you want to, go on to to the next level, which is the management, and definitely you want to get all the marks that you can in management. So what is one way that we can actually do to make sure that we maximize the marks that we can get in management? So what you are trying to do from your end, you're trying to show the examiner that you are going to offer a lot of different aspects in management, and you know that all these aspects are usually offered. Right, so there is a medical aspect that you can offer, there are referrals that you can offer, right? There are lifestyle changes that you want to offer, right? There is safety netting, there is leaflets, pamphlets, and there is follow-up. So by just saying this, I got 6 aspects. How many aspects did you actually talk about? And the further investigations to rule out other causes. So that is 7 aspects. So you basically spoke about 2. Do you understand?
Yeah.
And so much more to cover. So one way you can actually start doing this is, so you can introduce the entity, you can introduce what they might actually be suffering from. So whenever you are going into management, you need to talk about what you are managing. So introduce the patient with what they are suffering from, or what your thought process is on what this condition could be, right? So definitely give that aspect, say that from what you have told me, it seems that you could be suffering from, some memory impairment, and there could be a lot of causes that could be causing this, and talk about the different investigations that you would need to do in order to understand why you're actually having this, right? But even after that, I would also like to refer you to a memory clinic where they could actually do a more comprehensive or investigation on what could be the underlying cause. Along with that, I'd also like to give you some lifestyle advices that can improve your day-to-day activity and your your memory in general. I would also like to give you some leaflets and pamphlets so that you can actually keep that at hand if at all you want to refer back to this consultation and know more what you might be suffering from. I'd like to tell you a few signs to look out for, just in case if you do experience. I want you to avail medical help as soon as possible. And lastly, I'd like to also arrange a follow-up just to see how all these management plans are helping you in performing your day-to-day activity. So what would you like to talk about first?
Okay, so like we can summarize it and then just say to them which one would you like to talk about.
Exactly, because you're technically having a conversation, but you're also telling the examiner that I would be asking all these questions. I mean, I would be going into all these aspects if I had more time. Unfortunately, I hear the 2-minute bell. I understand that. So I'm just trying to wrap it up here. Yeah, see, that's exactly what you're supposed to. As soon as you hear the 2-minute bell, start wrapping it up. Because you need to move on, and you need to get those 4 marks for management. At least you'll get a good chunk. You'll at least get 2 for mentioning all the different aspects you would be doing. Right? Yeah, that makes sense.
Yeah, makes sense. Yeah.
Awesome, Dr. Ryan. All right, so let's look at your performance quickly. And one other thing that I want to ask you is, whenever you ask for orientation, if you ask time, that's not a very good question, because time is never constant. You want to ask something that is more constant. You want to tell me what the time is. There's no aspect of memory there. You're supposed to be reading time, so you just be looking at the the mobile or maybe the clock, and you would be mentioning time. But time is not a very good question for orientation, I would say. You could ask about season, what season is it, because that's relatively more constant. Does that make sense?
Yeah, that makes more sense. Yeah.
All right, let's quickly look at the results. All right, look at that. Data gathering is 4 on 4 because you've mentioned all the points that we've given. So good job, but you definitely need to cut that down. Even though, see, that's the thing, right? Even though you managed to get 4 marks over here, you could have gotten more marks in management, if you had given it more time. So you would actually be sacrificing just that 1 month because you're running out of time, but you would be getting more. You would go on to the level to get more marks. Definitely, you would want to do that. Yeah. So keep that in mind. So yeah, well, data gathering, good job on asking the full name, reason for the visits, why you feel your daughter feels that you have dementia. One good question is, what is your understanding of dementia? You would want to know what they think is dementia, because if they have any misconception, because that's a medical term, right? So your understanding of dementia might be entirely very different from what they think. So whenever they are, whenever they use a medical term to you, you would want to know what do they think that means, right? Because if they have any misconceptions on what it means, you can always clear that out, and you would be, getting marks on issue there. Because most of the times people don't really know what a medical term stands for, right? They may have a different understanding from what it really might be. Yeah. So that's a very good question. Explore presenting complaint. Ask, can you tell me more about what your daughter has noticed recently? Good job. Ask about explore symptoms. Ask about memory issues, specific instances and frequency. Ask about onset progression. Good job on that. Assess cognitive function. Inquire about difficulty remembering new things, forgetting names and significant date. Evaluate daily function. Ask about getting lost, driving, managing day-to-day activities. Rule out reversible causes, right? Delirium mainly. Rule out vascular dementia by asking about, past strokes, mini strokes. This is something that you actually asked me multiple times. You asked me, do you have any other medical conditions? Do you have any stroke? Have you had any stroke? Have you had any medical issues in the past? And then you asked me another question of, have you had any strokes in the past? So you actually asked 3 questions for this.
And you also asked, have you ever had any, situation where you, lost any, movement or, consciousness like that. So just try to put that into just one question. When you asked about any medical conditions, just ask any medical condition, including stroke. That's enough. Because especially because this is a case where you have a lot more data gathering to do, because your MMSE is going to take a lot of time. So try to skip the other questions when you're doing these ones.
Yeah, you want to be very, general about it. Do you have any medical condition, especially pertaining to any, heart conditions, any strokes, or any, issues with movement that you've experienced, And just quickly ask them in one go rather than repeating the questions over and over again, because that took up a lot of time, I noticed. Otherwise, mental health screening, check for hallucination and feeling depression, good job. Medical and family history, past medical history, medication, family history of dementia. Social history, inquire about living situation, daily routines, diet and exercise. That's also something that you could have actually, I would give you a partial for this one, because you could actually manage that, because if a diet consists of, mostly non-veg food and, fast food and unhealthy diet, you can definitely, offer a better diet plan to slow the progression of dementia. Yeah. Perform MMSE orientation tasks, registration tasks, attention tasks, recall tasks. Good job. Perform language. Yeah, I mean that's okay. I mean that's it doesn't matter much, because as soon as you get your positive finding, you want to move on because you want to get to the next part, right? So discuss findings, summarize concerns and findings with the patient, reassure and educate, explain memory issues and the significance of MMSE results. Explain possible differential diagnosis, including dementia, depression, thyroid issue, vitamin deficiencies, and medication side effects. Yeah. Reassure that memory issues can have many causes, not always dementia. Arrange immediate blood tests, full blood count, UNE, calcium, LFT, thyroid, vitamin B12, folate level, HbA1c.
But you managed to do this really well. So you tried, instead of going into details, you went over things quickly. That's a good way to do that. But another main important part that you missed in management is safety netting, leaflets, and follow-up. So never skip those aspects. Those are the things that will actually give you marks. So because the management, the medical and non-medical management is one aspect of it, but more important than that is they're going to see you whether you are a safe doctor. So if you don't do safety netting and if you don't give them leaflets and pamphlets, you will not finish your management at all. So even if you don't have enough time, try to finish these, try to prioritize those three first. So you tell your diagnosis, quickly mention the medical, non-medical management, and then immediately move on to safety netting, leaflets, and pamphlets before the time runs out quickly.
Yep, absolutely. Yeah, definitely take that advice. Immediate advice, yes. So that's another issue that, if you do leave them out in the society, would they be at risk to anyone? Just if it really matters if you have the presence of mind in these cases. But that's all right. Just very minimally affect you, though. Lifestyle measures, follow-up, safety netting, leaflets, pamphlets, yes. Empathy and active listening. I think your interpersonal skills were pretty good. Clear communication, build rapport, respect, and sensitivity involves the patient in decision making. Yes, asking questions like, would that be something that you'd be all right with? That's a good way to actually get them involved. Yeah. Signposting, reassure for hope and improvement with proper adjustments. Yeah, yeah, you could have added that. All right. Well, good job, Dr. Riyad. I mean, there's been a remarkable improvement there. So definitely, this is a very difficult station. I definitely understand, and there is a learning curve to actually be doing an MMSE in that given time. I'll link out the blog that we have made for this, so that everybody who is on the call, you guys can refer to this blog, especially when such a scenario does arise. Well, thank you so much, Dr. Rian, for that performance. It was incredible. And yes, keep booking mocks with us. We'll do a lot more scenarios, and I hope this was a useful session for you.
Yeah, I think I've just learned how to do a mini mental status exam in less than 8 minutes.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.